Coming from Illinois, when I first got to the clinic here in Georgia, I was taken aback by the fact that so many African American women were showing up to the clinic when I had primarily worked with white men who had sex with men before that. And I didn't really understand, having not lived in the South, what was the cultural dynamic with that. And I think the thing I was most taken aback by was how many things they were struggling with in terms of trying to do well with their health, and how many barriers that they had. There are environmental barriers. Many of these women didn't have good access to health care, both prior to becoming infected, as well as good health care related to non-HIV things afterwards. They struggled financially, economically, employment-wise, oftentimes related to relationships. Many of these women had a significant history of trauma. We are screening for substance abuse, mental health, and trauma. If they are substance using, they're eligible for our program. And if they are not substance using, but we identify mental health and trauma, we work to triage them so that they don't become substance users or put themselves at risk in other ways. All of these individuals are offered HIV testing as part of this screening. If they're substance using, we talk to them about our She Prevails program. And really, the goal of She Prevails is to help move from identifying the need for substance abuse treatment. Many women will acknowledge they have substance abuse issues, and will do that readily. But then when you ask them, so what can we do to help get you into treatment, there is often a huge gap there. The goal is to remove those barriers that she has. If where she's at is that she needs safer housing, so she's not afraid to go to care and have to come home, if it's an evening program, and be afraid to come home at night. If she doesn't have transportation, if she doesn't have childcare, if there are, financial issues or medication issues or healthcare issues, to try to work on all of those things. But I think what we're also really hoping that this does is that when you take away substance abuse behaviors and help treat mental health and help provide knowledge and power, that it lifts a woman's self-esteem, and it lifts her ability to connect and move towards her goals and believe in herself. It also, we hope, will decrease their risk of getting HIV, giving HIV to someone else, or having poor HIV health outcomes, because when a woman is strong and connected and engaged in her life and her community, she's able to make decisions that will help prevent those things from occurring.